Hello, and welcome to my presentation regarding Cancer Literacy Information Center, the standardization of cancer information app/platform. So I'm going to go over a little bit about me, the vision and mission, the market size, the product itself, the timeline and business model, and pricing and the competition. So a little bit about me. My name is Phyllis Go, and I'm a registered certified oncology nurse. Been working for over 13 years. I have a master's in health systems leadership and administration in nursing. I won multiple awards for academics and leadership, and I've published 3 books, 4 book chapters, and 17 peer-reviewed journal articles. The vision for this, also known as CLIC, to assist healthcare providers provide quality patient care. And the mission is to provide standardized cancer information to patients across Canada and to assist healthcare professionals' efficiency and their continuing education to ultimately provide patients with quality patient care. So this is just phase 1, our Cancer Literacy Information Center called CLIC, to serve the cancer population. Initially, it will be in Ontario and then spread across Canada, and includes access to health records, the ability to communicate with healthcare teams. It provides resources, treatment tools, treatment information and education, and clinical research. There's also includes full aspect of the patient's journey from prevention, diagnosis, monitoring to either end of life or survivorship. It's for pediatric and adult cancer patients. And for healthcare professionals who work in oncology, either an oncologist or a nurse or a physiotherapist, anyone that cares for oncology patients, this is the app for them. It is to improve continuing care for patients and to improve communication between healthcare teams. And it will decrease the risk of medication error on medical errors as well due to AI assistance. And it will link hospitals, inpatients, clinics, ER, emergency services, insurance, pharmacies, etc. Anywhere that a cancer patient needs to go, it should be connected for automation for smooth patient care. For the market size, just showing the initial stage for Ontario alone, there will be about 94,000 cancer patients in 2022 and 14,000 oncologists and 3,500 nurses that works in oncology. And this does not include any allied professional that's working in oncology, as well as pharmaceutical representatives, because there were no actual statistics that's located in Ontario. And so what this entails, the app itself, the initial stage, is better improvement in communication between their healthcare team and patients. Patients are able to communicate with each other, and information about their treatments and any side effect management. All of that's very easily accessible to the patients. It's just one click of a button for the physician or nurse to send to the patient. And the patient will have access to their health data and be able to complete forms and any surveys that needs to be done for the doctor. It will all be able to be done within an app and sent within the app. And the next one is for the collaboration, even with physicians and other health professionals, for example, regarding the patient care, if the patient had a recent fall or home care needing a question about wound care, it could all be collaborated within this app, because at the moment, if there's a question from a home care nurse, they write it on a piece of paper and then give it to the patient, all folded up and crumpled. The patient brings it to clinic, and that's if we could read the nurse's writing, or if the patient remembers to bring it. So it's a little bit iffy with how to get the information to our clinic at the moment. So this will be a more secure and efficient way to handle. Also, clinical trials, doctors will have this AI tool that will automatically glean over the patient's medical information and will be able to flag, FYI, this patient is eligible for 1, 2, 3 type of clinical trials, and the doctor can easily just click on it and get the patient to review the consent form and sign up to clinical study. So this will be amazing for a huge network of clinical trials across Canada, and researchers will be able to access those patients who have signed up, the ability for researchers to reach out to them, a list of patients and data that they can access and be part of their study. And also doctors and nurses will be able to access research grants, all of them in one app, instead of having weird random emails from different people, different sources, and looking up websites. So this is a much more efficient way for them to access research grants. And continuing education. So right now, for all health professionals in Canada, we have to track our continuing hours every year for our colleges, professional colleges, and we have to, everyone does it differently. Either they write it on a piece of paper or they type it in an Excel file, but basically you have to retype information and track it on your own. And it's sometimes you forget, and writing all the journal articles you've read. So this way it'd be much easier, because if you were to go to an educational event, like hosted by the pharmaceutical rep, they have it all within the app. They'll give the certificate and automatically track the educational event that you've attended. If you read a journal, a journal article, you just take your phone and snap the first page of the journal article, and it autofills the information for you. So much easier to track your information. So this will definitely help give more time for health professionals to do other things other than track their continuing education hours. So the timeline, we're hoping, obviously we need to attain funding and then survey patients and health providers in oncology to make sure that what our ideas for this app is actually what they are looking for. Because go to the source of the users and they will tell you whether, yes, you're on the right track, or, hey, add these on. So this is the best way to get buy-in. And then will be beta testing. Once we build the app and get it out to the beta testers, provide us with feedback, we'll have the app adjustments and incorporate any feedback that we're able to. And then we'll launch the app to everyone. And so the business model is, one, we're going to invest in our healthcare professionals that work in oncology, and we want to promote it at conferences, educational events, oncology organization, and especially with patients, word of mouth. And we want to affiliate with oncology organizations such as Cancer Care Ontario, Canadian Cancer Society, the Canadian Association of Nurses in Oncology, et cetera, that have protocols and information regarding cancer already. We don't need to reinvent the wheel. We'll just probably get like Browse AI to just monitor the site and continue to pull in the most up-to-date information into the app, so that healthcare professionals are always getting the most up-to-date information. So the pricing model for patients, always free, because they're going through a lot already with their health. They should not have to worry about having to pay for anything. And for clinicians like doctors, nurses, PTs, OTs, they get 1 month free to try it out, see if they like it. And then from then on, it'll be $1 a month for a total of $12 a year, something that they can afford and they will easily jump on because it's only like $1 a month. And for pharmaceutical reps, because it also helps their efficiency in their work and also provides them with a huge database of clinicians across Canada with all health professions that they get to send their information about educational events or product information. So this will allow them to pay $20 a month to use, and they'll be able to track attendance and provide attendance certificate all instantaneously. So it's definitely improves the service that they'll be able to provide. And once the app expands to other disease sites and across Canada, clinicians will no longer need to pay for the monthly fee, because the pharmaceutical reps will then, and also commercial companies like, for example, Walmart or Loblaws that have pharmacies within their organization, they will pay for the licensing fee. So that will sustain the maintenance of the app, as well as any extra funds will go towards the funding of healthcare professionals' continuing education. For example, attending conferences and having courses are quite expensive. So we'd like to try to cover some cost of it, not all, but just some. At least it helps them a little bit. And the vision is to standardize information and care across Canada. As you can see, in 2021, our population in Canada was 48.25 million, and it's estimated by 2050, the population will be 45.67 million. And we're hoping that everyone in Canada will be able to have access to this app, no matter whether you're really up north or south in Toronto or east or west. And people will get the same information for their disease site, and the doctors and nurses will be able to get the most recent protocols of care so they can provide it to their patients. Looking at other competitions that's similar, not exactly the same, but similar to CLIC, some features like patient communication, user-friendly chemo protocols, continuing education tracking, and collaboration with clinicians. As you can see, not all the apps have the ability. OncoAssist does have, it's quite user-friendly and do have chemo protocols, but it doesn't have the other aspects. The Cancer Therapy Advisor also has a similar to OncoAssist and the Manual of Clinical Oncology, but none of them are as fully encompassing as CLIC. So the pros and cons, there's always pros and cons to anything. So the pros is access to health information, and it's free for patients. It's standardized information and care and supports continuing education. The design will be very fluid and very easy to use. The collaboration with clinicians and patients right from the get-go, and they will have AIs to assist with patients and clinicians as well. For patients, if they were to have symptoms and they're not sure if they need to go to the ER, all they need to do is key it into the app, and the AI will assess their symptoms, including their medical history and their current treatments and medication, and be able to suggest an option, either go to ER, urgent care clinic, or call the nursing line, or maybe they'll be able to safely manage at home or go to a walk-in clinic. The option will be given to the patient, and once the patient chooses, they will be able to the app will give the wait times that are currently, for example, in the ER, and then the ER will be sent the information saying, hey, FYI, this patient has these symptoms and will be coming ETA this time because we have the GPS of the phone, and the patient will already be on that wait list. And when they come in, they just do the simple triage, and the time spent waiting in the ER will be a lot less. So this is great for patients and for clinicians as well. The only con that really has in this app is the cost to develop and maintain the app. Obviously, we can't really change that, but it's good that we have so much pros. And the next steps also include other disease sites, as I mentioned. And it's a wide range. It's basically going to cover the entire healthcare system for Canada and link to all the various aspects of the healthcare system, whether it's insurance or outpatient clinics or, hospitals, ERs, emergency services. Everything will be connected so that the patients will all have standardized information and care. So if you have any questions, please do contact me either on LinkedIn, email, or telephone. And thank you very much for listening to my presentation.